And now, a TV1 special presentation.
Hi, I'm Tavis, Smiley, and welcome to the Road to Health Tour. Our topic today, obesity and our children. If nobody ever gets on the road and creates a space for us to have this conversation about how to get our health in check, then we die. There's some fights that ain't worth fighting even if you win, but there are other fights you have to fight even if you lose. There's some fights we have to engage in for the benefit of those persons who we love in these communities of color. We don't have a single black or brown kid in America to waste in the fight to make black and brown America better, and for that matter, all of America better. It's tragic to consider that these kids, oftentimes with the help and consent, certainly complicity of adults, are digging themselves an early grave. Dr. Yvonne Butler, who I told you is the principal of Browns Mill Elementary and Magnet School for High Achievers, and in 1999, as I told you earlier, her school became the first school in the nation to become a sugar-free school. As a sugar addict, I wouldn't have wanted to go there, but just teasing. That said, Doc, tell me about how you navigated that journey.
Thank you, Tavis. First of all, I'd like to say that I am a survivor of childhood and adult obesity, and I almost lost my life 8 years ago to a stroke, and so it is a very, very vicious disease. Basically, once I was sober from eating all of the sugar as a sugar addict, I saw what was happening to my children. I saw children overweight, sluggish. I'm in DeKalb County, Lithonia, Georgia. Test scores were sluggish. I could not sit by and allow and watch my children become sicker or die. I had to do something as a gatekeeper. And I figured out that I would look at the diet in our lunchroom. Kids basically ate all of the carbs, all of the sugar, all of the chocolate milk. They threw all of the vegetables and fruit away. So I had to restructure the lunch plate so that they would eat the vegetables and not everything else. So I decided that, we have to take all of the bad stuff out. And I was smart enough to go to my PTA president, who was a Morehouse graduate, and convince him first. And basically what I told parents is, if we do not change the way that our children are eating, no fitness, then you're going to bury them. Harsh, yes, true. That was 7 years ago this year. Had some parents to say, well, you can't tell us how to raise our child. Well, I said, what I will tell you is that you will bury them before you bury yourself. And so it actually did come from the inside. Parents knew that. I tell people it's not about just having degrees. I had 4 degrees when I almost had a stroke, so I had an education. But it was the education that I didn't have about nutrition and fitness and how it was impacting my life. I educated my parents and I educated my children because children needed to be educated, because we as adults, we weren't doing it. We say we cherish children and we love them, but you gotta take a stand, and I took a stand to save my children's life, and my parents came on board, and my staff, and because of that, in 2005, we were the only Georgia School of Excellence, one of 3 blue ribbon schools, and you have to educate parents. We have parents, we're talking about, in some cases, low-income parents. I'm from rural Mississippi, born off a dirt road, raised in poverty, received welfare. So it's sort of difficult to tell a mother with 8 children to get 5 fruit and veggies a day and so much protein when you're just trying to feed your children. It's environment, it's culture, it's the climate. We have to look at a multitude of things inside the school. We have 55 million kids in public schools. 35 million receive lunch. They're a part of our lunch program. If we structured the USDA meals where kids eat at least 2 meals a day, 2 snacks, what an impact that it would have.
I'm curious though, as to the kids, when you told the kids, ain't gonna be no more sugar up in here.
Every school have leaders. You go to your school council, you go to your 4-H, and you convince those children. You know, they are the most popular, your athletes, and you bring them on board. But basically what I told them is that, you know, you look at all of these pop artists and R&B artists and athletes, and you like the way that they look, their teeth look. Kids are very vain and they're very competitive.
No.
Oh, yes. I said, if you change your diet and you start to work out, I said, guess what? You're going to be the smartest kids in the country.
And look like Beyonce.
And look like Beyonce. That was it.
Yeah.
3 weeks into the school, they noticed that we didn't have chocolate milk right away. And they said, oh my God, Dr. Butler's taking all the sugar out of the school. And after that, the rest is history. 2 years ago, I graduated my last class that had ever had processed sugar, chocolate milk, fried foods, all of that. It is all that they know.
You mentioned you're from Mississippi, and so am I. I was born and raised there. My grandmother, Big Mama, was born and raised in Mississippi. I raised that because Big Mama used to say something all the time. She would say, it's too much like right. That is too much like right. That was her way of saying that idea makes too much sense. It seems to me that what you have instituted is a program that's too much like right. Why is it not being emulated around the country?
Well, I think it's 2 things. First of all, of course, I'm not a scientist. I'm not a medical physician. Basically, beside my educational degrees, it was common sense and the wit of a mother. I am a parent. I think it's political. I had no idea when I started to talk about sugar, taking sugar out and vending machines out, way before President Clinton brokered the Alliance beverage deal, that people were hearing, and they started to fight that. As you know, in the South, this is where many of our beverage and our really gooey foods are based. And so...
What's that word?
Gooey foods. I won't say good foods, but they're things, they're comfort foods, things that we like. And so I ran up against, I thought we were on the same team. I was fine until I started to tinker with my USDA menus. And... you know, it was like draw the line in the sand, Yvonne, Butler. You know, you can't change these menus. You're going to get all of your federal money taken away from you. And I'm saying, I'm asking you all to come in and amend my menus. I just want to take ice cream and cake and French fries and put fruit and more vegetables. They said, well, you're going to kill the kids. This is basically what I was told. You're going to kill the kids. And then I started getting calls saying, you know, you're going to lose your job. And I said, well, basically, I had 3 before I came here. And I'm not going to change my stand and allow children to die. Because as your grandmother told you, when you know better, you do better. I knew better. And so it came from inside, like a grassroots movement. It didn't come from up top.
What makes that informed leadership effective is the evidence of results, whether it's in the healthcare setting or foundations. Both require evidence of results. And what I think we all need in order to take this program to scale nationally is more information about the effect it's making on children, their lives, their behavior, their skills, their academic performance, the costs of such programs and what it means in terms of healthcare. That's the bottom line for many of us, is to be able to identify whether or not these programs are working, whether or not they're best practices. We think the road to health, good health, ought to be paved based on good science, built on community partnerships, and focused on results.
Coming up next.
Parents do need to be responsible. I mean, in the Bible it says, train up a child in the way he should grow, and when he is old, he will not depart. So you have to lead by example. And so you can talk about it, but you've got to be about it.